everyone. Welcome to my channel. This is Live and Laugh with Linda. If you're new, I'm Linda, of course. And on this channel, we celebrate life, every aspect of life, because we believe that life is a precious gift and ought to be lived and celebrated. So welcome. I would love it if you would consider joining us and subscribing, and so please do so. Hit that subscribe button and give me a thumbs up and all the things. We'd love to have you. Welcome back, guys. Community that is returning. Let's do this. Okay, here's the thing, guys. I struggle with 6 autoimmune conditions, and I'm going to name them out for you right now. First of all, I'll start with arthritis. Osteoarthritis, psoriatic arthritis, diabetes, fibromyalgia, lichen sclerosis, and Sjogren's syndrome. That is 6. Now, I'm not going to talk about anything today except arthritis. I've gotten a lot of requests from my viewers, from y'all, to talk about arthritis and the struggles and all the things, because it sure enough is a struggle. Isn't that the truth, if you do have it? So what I want to do first is going to be in 3-part. I want to talk about what is arthritis, what are the kinds of arthritis, and what are the treatments, and tell you a little bit about my story. All right, y'all, so there's 2 different kinds of arthritis. There is inflammatory arthritis, and there's osteoarthritis or degenerative arthritis, and they exactly opposite. Both are very painful and can be debilitating no matter what. Now, for osteoarthritis, that's the arthritis that literally is the wear and tear of life on your joints, cartilages, all the things, and it's degenerative. In other words, you're losing joint mass and all of that throughout the years. And everybody eventually will have some form of this. It's just wear and tear, you know. I actually got an early onset case of osteoarthritis way back. I was in my early 30s. So there's just a great deal of joint disease in my family, and I've got the genealogy for it. Okay, so there's that. Then there's inflammatory arthritis, which is exactly the opposite. In fact, it is when your immune system is overproductive and it's literally attacking healthy cells, and it results in damaged tissue and damaged joints. And what happens is you have inflammation. These are the people that you see their hands disfigured and so forth. So inflammatory arthritis is where the joints not only swell, but they can be damaged and can cause some deformity that sometimes surgery can correct. Okay, so there's 4 kinds of inflammatory arthritis. There's rheumatoid arthritis, which is called RA. There's psoriatic arthritis, which is sometimes referred to as PA. And there's gout and lupus. That's the 4 types of inflammatory arthritis. I have PA, psoriatic arthritis, so I'm going to showcase on that one today. It is very difficult to diagnose psoriatic arthritis because if you don't have the severe psoriasis that goes with that pain, and sometimes that doesn't come on till later, it's usually a later thing, then the pain and everything presents as other kinds of arthritis or other conditions, so it's hard to diagnose. In my case, my daddy had it really, really bad, and that was back in the day when they didn't have real good treatment, and he suffered. He really suffered. My sister has it. I have a great deal of it in my family. So that was a huge factor in my diagnosis. Psoriatic arthritis, main symptom is inflammation of joints and a lot of pain. And the difference between it and RA, rheumatoid arthritis, is psoriatic usually only affects the hands. You see what I'm saying? The back, knees, and maybe feet. But whereas RA can be all over your body. Now, psoriatic arthritis is accompanied by symptom that you'd wonder, well, what's that got to do with anything? And that's chronic severe psoriasis. Now listen, I'm not talking about your head itching a little bit and you need some Head and Shoulders, okay? This is literally very painful and can come all over your body. And it is a skin, think of it like your colon and your insides is like a volcano, and it is literally erupting through your skin. And by the way, my rheumatologist explained it to me that anytime you have a skin condition, whether it be a rash, eczema, psoriasis, whatever it is a symptom of something going on inside, and it's just erupting out onto your skin in that way. Psoriasis like this can be huge patches on your arm, your back, all over the place, and it goes through stages. It can bleed. It can be painful. Also, it can just be itchy and all the things. And it's something that needs to be watched. You don't want to let it get out of control. So that's the difference between that one and rheumatoid. Here's what it feels like, y'all. The deepest ache you've ever felt in your joints. You know what I'm saying? I mean, like if you had the worst case of the flu, just ache all the way through your hands. And the main problem I have is that and stiffness. So I don't grip well. And this is kind of unfortunate for me, y'all, because I play the piano for a living. I mean, I'm a piano teacher, and I used to do a lot of performing. I don't do much anymore. I play for church like once a month. The treatment for this has gotten better over the years. I have done just about everything you can think of. Listen, I have been everywhere. I have paid thousands of dollars into holistic treatments, wellness companies. They all say they can cure you, and they all have tons of testimonials for you to watch and listen to and read that will tell you they were miraculously cured. And I want y'all to listen to me. Be careful. I have done a great deal of them. I've gotten some help, but I've spent thousands of dollars. So be careful, particularly of wellness companies that are pyramid, like multi-level marketing. Be very careful. The most help I ever got was at a functional medicine clinic, which it was a doctor that ran it, and that was a wonderful, wonderful program. If you can get into that, that's great. All right, so basically the treatment for psoriatic arthritis is twofold. It's for your joint pain and swelling, and it's for your skin. So number one, your swelling in your joints, they offer anti-inflammatory, non-steroid medication like, Motrin, naproxen. I've been on a slew of them. A diclofenac back in the day, Celebrex. I mean, there's just a lot of them. And they do help with the pain. I can no longer take them because I've been taking them since I was 30. And so for the last 3 years, I've been taking off of them because they will eat your stomach up. So, and that's medication for you. You can find something that'll help, but then you're going to have to deal with the symptoms and all like that. Okay, the other thing that is very helpful is a steroidal shot if I'm in bad shape. And maybe once, if I'm in real bad shape, I have had a Toradol shot. But other than that, I don't do anything narcotic. None, no opioids. Don't give me something that'll take away the pain completely. Because y'all, I will not come back from that. I will not come back from it. Nope. And then beyond that, they will work on immune suppressant drugs that suppress your immune system so that, because it's overactive. It's chewing your body up, being honest. So there's that approach. And then if your skin is completely out of control, today they have medications that will treat both. It'll treat it's all in one, the skin and the other. Now, I do take some medications. I'm not going to go into that. And let me just say right here, I am not a doctor. This is not in any way meant to influence anyone to don't take my advice. That's just not a medical thing. And I'm really not going to go into what I take because of that. I don't want to recommend anything. I do recommend that you do find a really good rheumatologist. You know what I'm saying? I've taken what I learned at functional medicine clinic, and then I have another, the other side is my regular doctor, and I do what I can handle. And that's what I do. Okay, so here is what I do to continue to function. So, but the main thing I do is I fight. I don't give in and I don't give up. I do not give up. And what I mean by that is I don't give up or give into depression, because it's so easy to be depressed when you hurt all the time and you can't do anything that doesn't cause pain. That is depressing. So I do a great deal of that, and that involves prayer, prayerful meditation, reading the word. I'm a Christian, so I rely on the Lord. Number 2, I keep moving. You have to move. Y'all, if I let all this cripple me up, I'm at the age now where I can't let up on stretching, trying to walk. Keep moving, keep moving, keep moving. And then the other thing is, do not overdo. Used to, I could push myself. Oh yeah, when this is over, I can rest. But many times that would put me in a flare up. And when I was younger, I could get out of it earlier, but not so much anymore. And there's a danger of me going into a full on flare up from all this stuff that I won't come out of. And I've seen people like that. So no, I order my life. Very, very careful. Basically, I trust God. And I say, as long as I'm breathing air, as long as I'm drawing a breath, it's a good day to be a good day. And lastly, diet and nutrition is very, very helpful. And I'll have to tell you, I'm not super successful in this field. I do as best I can, but I know I could do better. Because there's just a lot of foods that we eat here in this country in particular that cause a great deal of inflammation inside your body. Sugar, white flour, all that. And for the most part, I do my best, and I cheat now and again, as we all would probably do. But that's a huge factor, and you could probably really get a lot of relief just changing your diet. Takes a while to kick in. But anyway, I hope this has been helpful to y'all. Listen, y'all be blessed today. And if you're suffering from pain today, I just pray for you and I ask God to help you. Every day I get up, and one of the prayers I pray every day is, Lord, give me the health and strength to get done what I got to get done today. Then I get up and get on with it. Hey, find something to smile about. And I will see you guys next time. Bye now.